And good afternoon, everyone. How are you doing? Doing well? All right, I was saying it's cold outside. It might be a little bit of a shock, but at least we have the sunshine. So that plus the 70s this weekend, we have that to look forward to. I want to say it's just so wonderful to look around the room and see so many of you all here for such an important reason, supporting the mission of Marillac St. Vincent Family Services. And as Francine mentioned, I have the honor, the pleasure of serving as your host and the moderator this afternoon for the luncheon. And if you look towards the back, there are a lot of cameras flashing around here. We understand how important this organization is, and so we wanted to feature you on the news tonight. Fair warning, if you see the camera pointing your way, you might be on the 5 or 6 o'clock news. So just like you, I'm impressed with the breadth and depth of MSV's services. This organization has been dedicated to the north and west sides of Chicago for 108 years, for more than a century. Can you believe that? And they offer a full range of resources that cover the entire lifespan, from birth to seniors. Today, we are celebrating members of the MSV community who make this transformative work actually possible. We have a lot to be thankful for when it comes to MSV because we are also honoring 40 years of Project Hope and the positive health outcomes for pregnant and parenting young women in the program. These accomplishments are possible thanks to Rush University Medical Center, this year's recipient of our Outstanding Partner Award, and the doulas and parent educators of Project Hope, who we honor with the LOUISE de Marillac Service Award. Now, we will have those presentations with the awards, the hard way later in today's program, but right now I want to take a moment to acknowledge some special guests, our elected officials and our special guests that are joining us today. And then we'll return with our impressive panel. So joining us today is Alderman Walter Burnett and Alderman Timmy Knudsen. Thank you. Thank you all for joining and supporting. Our special guests include Dr. David Ansel and the team from Rush University Hospital, and the doulas and parent educators of Project Hope. Thank you all. All right, now it's time to soak in some knowledge. I think there are pens and paper under your seat because there's a pop quiz after this. So, fair warning, there's a lot to learn here. Okay, I'm the only one with pen and paper. Sit back, relax, but it's time to really soak in what these programs mean. Befitting this celebration, we are focusing today's program on the topic of maternal and infant health in communities of color. Given recent events, we are expecting to see an increase in births nationwide, and it is so important to have an infrastructure of health and social services prepared to support families in this journey. I would like to take this time to introduce our panelists who are here to discuss this very pressing issue. We have 3 joining us today. Dr. Gina Lowell, MD, pediatrician at Rush University Medical Center. Kirbi Range, Associate Director of Birth Equity at EverThrive. And LaRonda Castanet, Director of Project Hope at MSV. Please help me welcome them to the stage. Thank you so much, ladies. Now, before we get into our conversation, I want to set the stage for our guests as to the reality of maternal health for Black and brown women in the United States. The rates of maternal mortality and morbidity in the U.S. are some of the highest of any industrialized nation for women of color. We have some statistics we want to show you here on the screen, and I'll take you through them. So in 2020, out of 100,000 women, about 24 women died in childbirth in the U.S. And Illinois has an average of about 14.7 per 100,000. In Chicago, though, the rates are more than twice that of the national average, with about 48.6 maternal deaths for every 100,000 women. The zip codes in our city on the south and west side, that's 60612, have the highest mortality rates in the entire state. So, Gina, if I could start with you. Why are Black and brown women more likely to die in childbirth or postpartum?
This is such an important question, and the answer behind it is both simple and complex. But before I dive into that, I really want to acknowledge that the only reason I can speak to this is because of how the families that I care for in pediatrics and the stories that parents, mothers, fathers, grandfathers, grandmothers share with me about their joy in their children, their babies, their pain, their hopes, their fears, and also for the work of the Illinois Maternal Mortality Review Committee that examines each one of these maternal deaths in Illinois, Kirbi Range being on that review committee as well, and their careful examination of the circumstances that lead to these deaths. So what we understand about why it is that women are dying in childbirth is that during pregnancy and postpartum, one of two things may be happening. They come into pregnancy or postpartum period with a chronic health condition, and pregnancy is a state that actually increases physiologic stress as well as psychological stress in birthing people. And if you are coming into pregnancy with a chronic health condition, that can get worsened during the pregnancy or postpartum period. Now the question comes, why is it that Black and brown women should be entering pregnancy with a chronic health condition? Think about it, a 20-year-old with chronic hypertension. You know, how many of you, when you were 20 years old, had chronic hypertension, right? So that gets us to understanding what is the greater context around Black and brown women. And we have to start thinking about what we call the social determinants of health and the structural determinants of health. When you have opportunities to support women, right? Adequate access to housing, transportation, economic opportunity, educational opportunity, then you can prevent or mitigate health conditions that you might be entering into pregnancy with. But when those things are not there and not available, then those become risk factors. And we understand that that is part of what's driving the increased mortality rate in our communities of color.
Well, Kirbi, I want to turn back to you. I know she mentioned that you have some expertise in this as well. We were showing some of those statistics, especially about the south and west side. So what else is happening specifically in those areas of Chicago that cause these disparities?
Yeah, so definitely. So we know that Chicago is a very racially segregated city. And so as we were saying, we're seeing these higher rates of maternal morbidity and mortality and infant mortality on the south and west sides of Chicago. What we're seeing is that the services and supports that you are finding on the south and west sides of Chicago can look a lot different than what you're seeing available in other areas of the city. One of the things that's very alarming that we're seeing right now, particularly on the south side of Chicago, is there is a maternal healthcare desert. And so roughly about 1 to 2 years ago, there used to be about 7 birthing hospitals available for pregnant and birthing people on the south side, and now we're down to about 3 hospitals. And so that is a drastic change, and that's a huge disservice to pregnant people and being able to access adequate care in close proximity of their homes. When we don't have these services available, these healthcare services or community-based services available for people, it's really a disservice, and it's really continuing to impact their overall health outcomes. As Gina had mentioned, social determinants play a huge indicator. And so particularly on the south and west sides of Chicago, we see things like poor access to affordable housing. There's not high quality grocery stores with healthy produce, affordable childcare, and even thinking about transportation as a whole as also. So all these things are impacting people more profoundly on the south and west sides of Chicago. So it's this ripple effect that's really affecting people. And we shouldn't have to have mothers traveling to a completely another side of town to be able to access the services that they need to be healthy. There should be options here, in their neighborhood for them to get to. So I would personally feel as if my neighborhood or my city is not really supporting me in being healthy if I don't have these options. And so it makes people, especially Black and brown people who are composed primarily on the south and west sides of Chicago, think about how is my city really caring about my health needs if I don't have hospitals or healthcare systems available to help me and my children.
Well, along those same lines, you were talking about a ripple effect. And so, Lorana, if I could turn to you, and I want to open this up to all of you. If we talk about the impact that the high rate of maternal deaths and postpartum illness for Black and brown mothers have on the community, for instance, the family, not just the immediate mother, but the family, other factors like education, what would you say would be the larger impact?
Well, when we lose parents during childbirth, it really impacts the family because the fathers are left to raise the children. The grandparents are left to raise the children. That whole support system is interrupted. And it's really difficult. As the children grow older, sometimes there's stigma about that. And it's really difficult to focus in school if you're feeling stressed. So the impacts can be long-lasting for the children as they grow up in the educational system.
I'm so glad that you brought up that idea around that dealing with stress, right? We have this term that we call toxic stress or traumatic stress. And we understand that those experiences of traumatic stress, losing birthing parent during childbirth or in the postpartum period, and other experiences of traumatic stress have a direct impact on our health outcomes, both short-term and long-term, has a direct impact on our mental health outcomes, experiencing PTSD or depression or anxiety. And we also understand that those conditions directly impact whether or not a mom might give birth to a preterm baby, a low birth weight baby, go into early labor, or survive labor. And so understanding that stress and distress happens not only in the immediate aftermath, but also crosses generations, that's a bigger part of the ripple effect as well, that it doesn't just stay with one generation. The experiences of trauma don't just stay with one generation, but they are passed generation to generation.
And Kirbi, is there anything that you want to add to that? Okay. Well, I want to expand on your point there about the health issues and what specifically Rush is doing to address those, the outcomes in Black and brown communities. So you talk about stress. What other health issues are there, and what do you feel like the solutions could be from a Rush perspective?
There's several different ways that Rush is addressing birth equity right now. One of the ways in which we're connected to Marillac is that all of our pregnant and parenting people are screened for their own childhood trauma and experiences of childhood trauma. And those who we find are experiencing that, we try to directly link to programs like Marillac's home visiting and Doulas support programs. Because we understand that trauma is experienced, and yet we can also mitigate the effects of trauma. And the way that we can do that is by building stronger relationships. And that's exactly what the doulas and home visitors of Marillac St. Vincent do. They really help pregnant and parenting people build strong relationships with their babies and with each other through groups and things like that. Other things that we do too, though, however, is really addressing this lack of access to healthcare that Kirbi was talking about. And so one of the other ways that pregnant and parenting people may access healthcare when they're living in a maternity care desert is to use emergency rooms as care. And so one of the pilots that we're doing right now is making sure that we're able to find every person who's been pregnant or is pregnant within the past year who's seeking care in our emergency department and link them with a community health worker who can support their social determinants of health and connect them to the appropriate OB care that they may need.
So Lorana, I want to turn back to you because the mention of the doulas and Project Hope. Tell us more about this program, and in particular the doulas, how they help make a difference in these outcomes.
Yeah, so Project Hope has been helping parents for about 40 years now. And we've had a doula program put into the program, which helps mothers prepare for labor and delivery and early parenting. It's really good to have that extra layer of support. The mothers learn information about educating themselves to prepare for their labor and delivery, what to do when they get to the hospital, how they can talk with the doctor to advocate for themselves when things seem that, if things seem not to go the way they want, that they have that voice. They can speak up and be directive in their delivery. And we also help them with the early parenting. So the doulas having that relationship, they learn to trust and they learn to be ready. When they actually go into the hospital for labor and delivery, the doulas are present with them for support. So they're there not just for the mothers, but the fathers, the grandparents, anyone who's at the hospital for the mother, they're able to support. We were very fortunate during the pandemic. We were able to continue services via Zoom. It wasn't ideal, but the doulas really wanted to be there for the mothers, to be able to support them, to be able to say, hey, I'm a shoulder here, you can talk to me. Do you have any questions? I can help you to know how to talk to the doctors. I can let them know, what you need and how they can best serve you.
So Kirbi, I want to turn back to you, and then I want to open it up to all of you. If we talk about really changing the trajectory, this isn't an easy solution, but there are definitely pieces to this that, we can all do. So before I ask you about what everyone else in this room can do, what do you think that different people in the community, the roles as doctor, the role as mentor, support, can do to really ensure that mothers have healthy pregnancies and healthy births? And how does your work specifically address that issue?
Yeah. Again, this is a challenging question because there's so many layers in what we can do. And I think the most important thing is to remember is that it is not onus on an individual person to really be able to address all their health needs. It really takes this collaborative effort. We need our community members, our community organizations, our city and state health departments, our hospital systems, insurance, and the list goes on. And so this is really a collective effort to really be able to address maternal and child health outcomes. I think I really want to emphasize the importance of leveraging community voice into all tables. It's important if we're going to make any type of substantial change that we need to hear the lived experiences of people to really truly understand how they're being impacted, what is happening in communities, and to really inform what are the exact solutions that we need at the policy level, at the community level, at the individual level to really make those changes. And we need effective data to really understand also about the disparities and the inequities that we're seeing across races. And so that's very important. Speaking of the incorporating community voice, there has been a couple of projects that the organization I'm with, EverThrive Illinois, has been involved in really tackling the maternal health crisis. One of those projects is the Chicago Collaborative for Maternal Health. We just wrapped up a 3-year project in partnership with the Luncheon Chicago. And the purpose of that project was, again, to really think about how we're combating maternal health. We partnered with federally qualified health centers to really think about how they can improve their practices with working with people getting connected to primary care after they have had their child to make sure that they're monitoring any high-risk conditions that they have, such as hypertension or diabetes. And then we're also had 2 components that were focusing around community engagement and policy. So with community engagement, we did focus groups with several community members on the south and west sides of Chicago to really understand about what do community members understand about maternal health. Terms like mortality and morbidity are not common terms that community members used, and so we educated community members about this topic and to find out what was it like for them to access care and services in their community. How do they feel morbidity and mortality is affecting their areas? And we learned so much, and many of the things that you all have heard before, that people feel that there's not, they mentioned greatly that the connection that they have with their healthcare system or their providers was lacking. And many people feel that they cannot trust their providers, that they're not being heard, and that they're not being engaged in their services. And it's really disheartening, especially when we're hearing that primarily Black and brown people don't feel like they can trust the care that they're receiving. So we've been using this information to think about what are the things that people need to really advocate for themselves and for their health. We put together a campaign called the Gathering Campaign, and it's really a robust toolkit website to really support people in the community with what they need to know about advocating for themselves, especially in the postpartum period, emphasizing the importance that all people should be taking care of themselves for at least and monitoring their symptoms for at least 12 years after having a child, and not just those 6 weeks. We also have something, for instance, like a glossary of terms to really bridge those gaps in the language between the medical providers and the community. So again, you know, for our medical providers, when they're sharing different terminology with families about postpartum, many people may not be able to understand what that means, or they may associate it with postpartum depression. So we need to make sure that we're using more common terms, such as, you know, after you've given birth, how are you feeling? And instead of, you know, using the terms mortality and morbidity, we can say, you know, for mortality, simply just using the terms that this mother has died, you know. So there's various different projects that the city is really working on. Another one is Family Connect Chicago, where registered nurses are coming into the homes of birthing parents and really making sure that they have that connection to a full health screening for themselves and for their child, and connecting them to resources in the community. And so we're really making sure that we're engaging community members and organizations in this work so that they can be a part of the solution and understanding what are the needs of people, so we can integrate those services into the community.
Oh. Well, a couple of things I want to touch on, and I saw you, Gina, nodding there, but boy, that really puts it in perspective to say it's not just the weeks after, but the 12 years.
12 months.
12
yes,
months,
yes.
12 months afterwards to really be aware of your health. But if we talk about from a medical perspective, the trust. A lot of times, you know, women, when they're going in, they don't feel like they're heard, or that their pain is actually acknowledged, those types of issues. So when Kirbi was mentioning that and how big that is, from your perspective, what are you seeing and how are you all working to sort of bridge that gap?
Absolutely. I think that that is one of the greatest barriers to effective care, right? Effective care of a pregnant or postpartum person is overcoming that, or being able to address the fact that there are clear issues in availability, accessibility, and trust of services. And when that trust is breached, the feeling as though a person may come back to your organization, the chances of that happening just go down and down if trust has been breached. And so we have to be able to understand that we all come to the table with implicit bias and sometimes explicit bias too. And so an organization such as Rush that undertakes implicit bias training for all of its providers, as well as not just sort of the, you know, that checklist approach towards have you done the training, but actually following it up and following through with those practices and consultation that can really help providers understand what they're coming to the table with when they're caring for people in their offices. We're really proud to also be part of the Family Connect Chicago pilot as well. And one of the things I wanted to add is that when you think about what are the things that we can do to help support pregnant and parenting people, so many of the times we have kind of services and programs that are more targeted to what folks might think of as the at-risk communities or at-risk people. What the beauty of Family Connects is really that it's a universal program. Everybody has needs, and we have to understand what the range of those needs are. And then to meet our health equity goals, if you have a family that has a high range of needs, you meet that high range of needs. If you have a family that has a low range of needs, you meet that low range of needs. And this is the definition of equity and how we can achieve it. I think the other big thing that we need to really, and that you were speaking to, Kirbi, too, these data systems, right? We really need to figure out and think about, in a radically different way, how can we open up these lines of communication? There's so many touch points around a family, and all of those points contribute to that family's health. How is it that we can actually get interconnection amongst those different touch points and open up lines of communication, rather than always feeling like you have to operate within your own section and you can't necessarily cross a bridge, reach out, and talk to that other person or service or program that's also impacting the family that you're caring for.
So last question to all of the panelists. Please feel free to jump in. Loranda, I'll give you the floor first. So if we're talking about looking around this room, we've got some pretty impressive people in here. So what can they do? What role can they play in changing the trajectory that we're on when we talk about these issues, maternal and infant care?
Yes, being educated about the situation is very important. So just having events like this to gain awareness of what's going on, to be able to support, to be able to come in to volunteer with our programs are usually very helpful. And to also be able to provide any support or services that people have, to be able to contact the agency and let them know, and so that we could reach out and receive the things that they have to offer.
Gina?
I think that people are so ready to help support pregnant and parenting people during this time. And so if you feel like, well, I want to do something, but I'm not sure that someone would work with me, reach out. I think people are so ready to help and to connect and to work together towards a common goal. I also think that the period during pregnancy and parenting is one when parents experience a lot of judgment. A lot of judgment from perhaps healthcare providers, a lot of judgment from sometimes family members, sometimes community members, sometimes society. And if we can, instead of judgment, be curious, that can really help us overcome some of that bias that we come to the table to.
And Kirbi, we end with you.
I definitely echo what LaRonda and Gina has shared, and I think we just need to be okay with being uncomfortable with this conversation and this topic and recognize that there is a maternal health and a crisis going on right now. We do see these disparities. And so, as LaRonda was saying, we need to educate ourselves on this topic and think about, in each of our capacities, I know everyone's coming in different spaces, what can you do in this space to really address maternal and child health outcomes? Because it's only getting worse, and we need to do something to really improve this, or our mothers and babies are going to keep dying. So we need to accept that, that there is, unfortunately, inequities, especially for Black and Brown communities and for families. And so, again, be sure to find ways that you can be a part of the solution in having these conversations. Again, include community voice into your projects, into your research projects, into your discussions to really understand what people need. Invest in communities, find out what needs to happen. Mental health is a serious issue right now for people, and we need more mental health providers and services to support people. We need more adequate housing. We need to have more, healthier options and services for people. So continue just to think about what you can do in your capacity, in your line and field of work, and think about also how we collectively, again, come together to really tackle this issue.
And I just, along the lines of people searching for solutions, I wanted to mention the Mama Act. If it's something that you all are familiar with, I just wanted to give a little bit of information to you all as well, because I was learning about this from MSV, and of course it's been a work in progress for several years. So Senator Dick Durbin introduced this legislation to lower America's rising maternal and infant mortality rate, and specifically looking at racial disparities, trying to reduce those in health outcomes. And like I said, it's been a work in progress. So it's been over several years, 2019, and now then in 2021, Senator Tammy Duckworth got involved as well. And they're really trying to look at before, during, and after pregnancy, as you all mentioned. So I just wanted to throw that out there to let you all know that this is legislation that's at least on the radar of MSV, and thinking about ways that we can, further support mothers and infants along the way. So with that, I want to say thank you to Gina, LaRonda, and Kirbi. If you could please join me in giving them a round of applause.
Hello, everybody. Hello, if I can have your attention, please. I hope you enjoyed your salad. It was very tasty. I love arugula, so I'm glad we had that specific meal. My name is Veronica Brown. I'm the Chief Development Officer at Marillac St. Vincent. I am about 7 months here with the organization, so there's a lot of new faces for me in the room, and I hope to meet each and every one of you personally today at some point. For now, I'm here to introduce our video that celebrates 40 years of Project Hope. So without further ado, roll it.
Seeing that baby come into this world is like new life, new opportunities, new inspiration. Everybody loves babies.
Come on. My name is Monet Dixon, and this is Truth Dixon, my 2-year-old. I was incarcerated, and I was on a pregnancy tier, and if I didn't have Project Hope, I probably would have been one of those people that had their baby in jail and had to give them away. And they actually helped me, and I was actually able to get out 3 months before having my son. They became advocates for me. It was what we needed, hope.
I feel like when you're a mother, you so many things. I'm a doctor, I'm a teacher, I'm a referee. I'm so many things, and it's just like, wow, this is a lifetime job. I love being a mom.
Project Hope was started 40 years ago by my mother, Kay Halligan, to serve young families and particularly young women on the west side of Chicago who were pregnant and parenting, to offer them services and resources.
Over the past 40 years, we've served 850 women in the parenting program. The United States has one of the highest maternal mortality rates of developed countries. We've been fortunate that we have not lost any moms during labor and delivery. And this is really important because in Chicago, Black and brown women are 3 to 4 times more likely to die in childbirth.
When we love and support young moms, we create change, we create possibilities, we create hope, and we create future potential that is endless. Project Hope is a parenting program for young and parenting moms as young as 13 up to 25 years of age. A lot of the moms are single moms, but then we try to make sure that the fathers are welcome and that they are equally celebrated.
I was young when I had my first baby, so I didn't know nothing about being a mother, about taking care of baby, nothing. It was a blessing when I heard about this program and why I stuck with it, because it's very helpful and they're always there for us.
When I came to Project Hope, it was like a lot of help because I was a kid myself and I was raising a baby. It made me feel good to have that love around you, because what would I would have done without them?
At Project Hope, we mother the mother so that they can mother the child. A doula is a layperson who assists with pregnancy, labor, and immediate postpartum. My job is to give them the information and give them the confidence to make those decisions and to advocate for themselves so that they can then learn how to do that for their children as their children get older.
I'm a specialized doula. I work with the incarcerated women in Cook County Correctional Center and the Illinois Department of Youth Correctional Center. I consider every last one of my young ladies I help family, and they love their babies. They make the choice of having their babies, and they want to be the best mother that they can be, even though they're in the situation that they're in. And once they know that you're there for them, we give young people hope. We give them inspiration to do what they need to do to be able to care for themselves and their babies.
When I was locked up, Project Hope helped me get out of jail. They helped me get a doula. Thank you. Thank you for letting me be a mom. I didn't have my mom, so to be able to be a mom and give something back, something that I want, it's amazing. It's the best job I ever had. Project Hope is an amazing program, and I pray that they keep it.
Wow. That, to me, that video just speaks to the love, the unconditional love that our parents, our moms, bring to this program when they show up, and they show up every single day to put the work in, and they show up every day for their children. And we are so proud of them and everybody that has gone through this program, and we are proud and love our doulas and our parent educators who make all this work happen. We are now going to go into the paddle raise portion of the afternoon, and hope that you will all join us in helping to raise the much needed resources to continue, hopefully into another 40 years and beyond of Project Hope. Pete?
Good afternoon, everyone. Thank you for being here today. And I had a friend just say, you know, the paddle race thing's a little easier in the evening events because there's usually a cocktail or two involved. And so we don't have that today at lunch, but we're going to have some fun. And I'm going to come back to Francine's invocation and a little bit of our conversation earlier today. You get to do your part. You might not be able to come in and help in the program, but this is a way that you can support what we do, not only in Project Hope. For those of you who are new, in addition to Project Hope, where we're helping the pregnant and parenting teens, and obviously, so we say we work prenatally, and all the way to the programs we have for seniors. Our oldest senior's 102. So it's that full life gamut when we say family services. So you'll see some things up on the screen today of different ways, different levels that you can support. We're going to focus on the ones that talk about Project Hope today, but you'll see others up there. So the way it's going to work is when you came in on your chair, there was a program and a card. The card looks like this. So if everyone can find your card, you might still be sitting on it. The way it's going to work, there's no names on it. There's no bidder number. Just to help us back, we're going to ask you to, when we get to a level where you want to participate, to just hold that card up in the air, and then Veronica and I will acknowledge you. And then what we'll ask is, there's two ways to give. You can find on the bottom, there's a QR code. You can use your phone, and you can scan that, and you can give electronically. Or, as you can see, there's room to fill in the card with your information, and you can give it to one of our volunteers. And could I just have all the volunteers who are standing around the room wave their hands so everyone can see these are the people you want to give your card to after you fill it out. Okay, here we go. We're going to start with our first level at $5,000. So the first thing that we have up there are our weekly Project Hope meetings. This is a chance for our young moms and dads to come together on a weekly basis to get expert advice in parenting and to be able to ask their questions, a safe place to ask their questions. And also, I mean, a lot of you in the room, I think, are parents, even if you're not a parent. I think everybody knows parenting is a tough job. And so to even just have a place where you can commiserate with some other peers about the struggles and challenges of raising children. So that's what happens in these weekly meetings. And so I'm wondering, is there anyone in the room who could help us at the $5,000 level with these weekly parent meetings for Project Hope? Thank you very much, Dorothy. Thank you. Yes, let's clap. Clapping always encourages the giving. Anyone else at $5,000 can help us? Going once, twice. Okay, we're going to move on. Go ahead, Veronica, you're up.
All right. At $2,500, so for $2,500, we will be able to purchase 25 car seats for our Project Hope participants. And car seats are very important in order to get our kids where we need them to go. Hospital visit, not hospital, but doctor visits, when we have to get to work and drop our kids off at childcare. At this level, we'll be able to purchase 25 car seats. And so do we see anybody at this level who can help us help our parents get back and forth safely with their children?
Over here, thank you.
Over there, thank you, Kevin. EJ, thank you so much.
Thank you.
Did I miss anybody?
Thank you very much.
Thank you.
Anyone else?
Your support. At this level, as you can see on the screen, there's some other stuff that this helps to accomplish, but
Now we're on to $1,000 level. Carrie's keeping us on track today. So, providing the one-to-one job readiness training for 10 Project Hope moms. So we approach workforce development with the moms and the dads at times holistically. It's not just about getting the job, it's about how do you keep that job. And what do you, oh, thank you very much. Raising paddles, but I didn't even get to fully explain. Thank you, Bertina, very much. Thank you very much. Thank you. Thank you. It is a wonderful way for us to impart emotional intelligence, communication skills. How do we, thank you very much. And it just helps to keep that job once you have it. So thank you very much. Anyone else at the $1,000 level that are doing this? Thank you so much. The background, thank you very much. Any others? Fantastic.
okay, at $500, we have, we're able to help one project mom secure, help them with their security deposit so they can move into permanent housing. Oftentimes the clients that we're with are not necessarily in a safe and secure environment. So ensuring that they are in a permanent housing so that they can focus on their prenatal care and on the baby and their health is of primary importance. So at this level, we can help one of these moms get into permanent housing by providing them with their security deposit. Any takers here at this level? 500. Thank you, Francine over there.
Thank you,
Dr. Lowell. Thank you so
here
much.
At this table. Thank you very much,
Up
both
here in
of
the
you.
front.
Thank you.
Thank you so much. We really appreciate your support.
Fantastic. Anyone else at 500?
I'm missing
Going
everybody.
once.
Anybody on that side?
Little commercial.
I'll walk over.
QR
there.
code so you can find it. If you can't find it on your card, you can scan it right off the screen. All right, fantastic. Let's move on to $250. And with this, we can purchase 10 handheld breast pumps for the nursing moms. The incredible benefits of nursing are proven again and again, and it helps not only the baby, but mom as well. First, with just the bonding that happens between them, which we know from research promotes brain development. And then also the benefits in terms of just the nutrition for the baby, but it's also building the baby's immune system. In addition, for the mom, it helps to stave off postpartum depression. And so there's benefits both ways and individually for both mom and baby. Is there anyone who can help us at the $250 level? Great, thank you so much. Thank you. Thank you very much. Thank you. Thank you. Thank you all very much. More on the other side of the room over there. Thank you very much. We truly appreciate you joining in today and doing your part. Fantastic. All right, Veronica?
Great, at the $100 level. So we know how important family bonding is and family time. So at this level, we'll be able to provide some resources to help a family go on an outing. Enjoy the best that Chicago has to offer. Oftentimes, our families are on a tight budget, and especially these days, budgets are even tighter than normal. So we can help them get out of the house, get out of their neighborhood, go see a movie, a bus pass to visit a museum, all this wonderful cultural scenery that we have down the street here, the Field Museum, Shedd Aquarium, down the street at this Museum of Science and Industry. We're able to provide them with tickets, bus passes, and a gift card so they can have a meal. So if anybody wants to support at this level,
Thank you so much.
Thank
much
you
appreciated.
so much.
Thank you both right here. Thank you very much. Thank you here at this table.
Thank you so much.
Thank you very much. Thank you all. Anyone else at the $100 level? One final level, and you may have figured this out already. $40 in honor of the 40th anniversary of Project Hope. So a little alliteration there, I guess, if you can do alliteration with numbers. And so, but it helps us with any number of things, baby toys, teething rings, those kind of things that we can buy. So if you have not yet raised your paddle today, or your card, we ask you to consider joining us. We're trying to, if we can get everyone in the room to do something, it would be fantastic. Thank you so much for your participation today. If you can join us at the $40 level, if you could raise your paddle, that would be fantastic. Even if you've already given, if you want to give another $40, that's fantastic too. Thank you so much. Really appreciate it. Thank you very much. Thank you at this table here. Thank you all for helping us to celebrate the 40th anniversary of Project Hope.
Thank you, everybody. Thank you so much. We really appreciate everybody in this room. Thank you for helping us to, get to this point. 40 years of Project Hope, 108 years of Marillac St. Vincent. We are now going to move into the awards portion of the day. Maureen.
Good afternoon. Is that on? Can you hear? Good afternoon. My name is Maureen Halligan, and I have the honor of awarding Rush Medical Center the Partnership Award with Marillac St. Vincent. I am so honored to be presenting the MSV Outstanding Partner to Rush Medical Center. Our partnership with Rush started 40 years ago with the start of Project Hope. At that time, we were developing Project Hope. We worked with Rush's adolescent clinic. Rush was still, even at that time, was striving for health equity for the young families we were serving. Over the years, our partnership with Rush has become stronger. Several decades ago, we joined Hatch-Adams program, which provides greater science and math educational opportunities to one of our dedicated pre-K classrooms. Rush has been a strong leader in bringing Westside communities together to dismantle barriers to health and promoting health equity within Rush and in the community. Gina and the Rush team have been strong advocates for our doulas and family educators, not only with our services, but educational opportunities such as trainings. During the pandemic, Alma and her team of nurses reached out to MSV to provide vaccines for COVID-19. They provided on-site vaccines weekly at our East Garfield Park site. The nurses that came were amazing. There were some days where it first started out, there were only maybe 1 or 2 vaccines that were given, but they hung in there, and for a year and a half, they came every week to give the vaccines. But the beauty of what they did was not just giving the vaccines. They took the time to educate anyone who came in about COVID, and they also about the vaccine. They tried to develop the trust with the health professionals so that people felt comfortable taking the vaccine. They also provided then ongoing information for how they could connect themselves to a better health care. MSV received home tests to give to staff and the people we serve as part of Rush's pilot program to provide communities with free home testing kits. The life expectancy gap between people who live in the Loop, 10 minutes apart, and people who live in parts of the West Side, which includes our areas of West and East Garfield Park, is 16 years. Dr. Ansel and his team are focused on closing these gaps and bringing health equities to communities of color that have not benefited from best practices in healthcare. Marillac has participated in Rush in many of these opportunities. Marillac St. Vincent has been an active partner with East Garfield Park Better Baby Zone, BBZ, is designated to address racial disparities in infant mortality, birth outcomes, and maternal health. We have also been partners with different parts of the team at Rush on bringing services and workshops to our Take Charge seniors about asthma, diabetes, and hypertension over the years. As you heard on the panel, the disparities in maternal and child health are extensive in East Garfield Park. Our communities have one of the highest rates of infant mortality, not only in the city of Chicago, but in the country. We also have partnered with Rush, Kofi, and other community-based agencies with the Bridges program, building relationships, generationally effective system. I always have to look at what that actually stands for. The goal is to help families heal from trauma and build resistance. These are just a few examples. There's so many more that we have about Marillac St. Vincent and Rush working together, along with other healthcare facilities and groups on the West Side. I am so honored to present the MSV Outstanding Partner Award to Dr. Ansel and the entire team at Rush. We are very grateful to work alongside you in the community. Congratulations.
I want to say our nurses service, a doctor cannot receive this award. I'm either smart enough or when I think I'm smart, I ask the nurse. So I want to thank Sally and Maggie just on behalf of Rush. I'm going to give this to you because you guys really deserve it. So thank you.
Dr. Ansel just told them now that they're in the picture, they have to stay at Rush another 10 years. The final piece of our program today is our last award, the LOUISE de Marillac Award, which we are giving to our team at Project Hope. You know, Project Hope has an incredibly rich history, starting out with funding from Irving Harris, and he was just so passionate about the needs of the most vulnerable children and their families. And then we made partners with, at the time it was called the Ounce of Prevention Fund, now known as Start Early. And I think we have a few of our Start Early friends with us today. We now not only partner with them with Project Hope, but they're through our Early Head Start and Head Start program, we do through Start Early as well. So we're thrilled to have them with us. Other places like Health Connect One, and of course Rush Hospital. There's been so many partners that have pulled together this program to make it happen. Many of you have seen a doula story. It's a documentary that followed our first doula, Irika Sargent, may she rest in peace, around the city and doing her work. And that took us, our program on the west side of Chicago is now known internationally as far as Japan. And what's really important is the fact that for the west side and in Chicago and the statistics that you've heard, that we haven't had the statistics, unfortunately, that do exist, that we haven't lost a mom in labor or delivery. And we haven't had a low birth weight baby in over a dozen years. It's a true testament. Indeed. So it's a true testament to the impact that Project Hope has on the community. We didn't even know that the infant mortality rate was double the national average right in our backyard because it just wasn't our experience. But how does that happen? How are we so successful? It's the talent and dedication of the team that shows up every day. the leaders of the program, like Kay Halligan, who you saw her picture, who started the program, Maureen, who was up here, who directed the program. What was it, 18 years, Maureen, I think? Kirbi Range, who was part of our panel today, and of course, LaRonda Castanet, who was also part of our panel, lead that team of the parent educators and the doulas who you met in the video today. I'll name them. So Mary, Melanie, Lanice, and Nat are that team that work with LaRonda. And, you know, they work with, try and picture it. Sometimes a 14-year-old mom who's feeling scared and alone and desperate to have a partner on that journey. And it makes their job complex. And they wear many hats. I made myself a list, but motivators, coaches, chauffeurs sometimes, getting them to those medical appointments, schedulers, you name it, they do it. They educate, they lend a shoulder to cry on, they connect teens to medical care, they help young parents find work, they make home visits, they make visits to Cook County Jail, they reassure young moms that they indeed can do it. They help create birth plans, and the list goes on and on and on. And I don't think I could say it any better than one of our past program participants who said it so well. She said, Project Hope has been a godsend for me. I felt so alone when I found out I was pregnant, but this program gave me the strength and confidence I needed and showed me that I could get through this and be the best mom possible for my daughters. And it doesn't happen without hours and hours and I don't know how many phone calls and emails and chasing people down and making it all they're all laughing over there. They're like, yes, 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 and a lot more. Please help me to thank and honor our team from Project Hope. Where is Maureen? I want her to wave her hand again. Maureen Halligan. There you are. Okay, and I'm going to invite Mike Condren, who is the chair of our Board of Trustees, to come close us out. Mike?
How about this, everyone? We actually are early if I look at the Northwestern clock on the wall, but sometimes you got to check when you pay the tuition there. It's a little, sometimes it can be a little ahead of things. So I want to welcome, before welcoming, thanking you all, I want to acknowledge everyone in this room who came out today to support what we do at Marillac St. Vincent. So I'm going to ask just a round of applause for all of you. Thank you. I have the enviable job of getting ready to announce the raffle winner. So if you've stuck around this long, that means you're sticking to find out if you won the raffle. So whoever will, Carrie will help me with that. Before I do, I want to acknowledge our committee. And Carrie, who's coming to the stage probably to tell me the 3 things I didn't do well, I want to acknowledge Carrie. So can I have a round of applause for Carrie? I now know the name of the winner, but I'm not saying. I want to also just acknowledge a few folks, our committee that puts the Beacon of Hope together. Ann Mira, Jackie Langus, Dorothy Giganti, Kimberly Walters, and Rob Christopher. This group makes a tireless effort to put this event together, and we're very proud of the event because of what you learned today, what you got to hear. When we think about the program and the success we've had at Hope Junior, it really moves me to think that the Halligans, follow in their mom's tradition. And I want to acknowledge Deanna and Maureen who are here, but the entire Halligan family for what they do. It's in our city, and I know we have some elected officials here today and others that are influencers. It's great to hear our progress of what our program does, but I will say it is unacceptable to hear that women in Chicago, women of color, black and brown women, 3 to 4 times more likely to die in childbirth. That's unacceptable. And we're here to change it. And so if our program makes some component of change, wonderful. But we're also here to expand at Marillac St. Vincent. In the next 3 to 5 years, we're going to be focused on how we can better serve at Marillac St. Vincent to change that dynamic throughout the city of Chicago. And we ask for our elected officials, we ask for all of your help in helping us to grow our program. So please give that some thought about how you can volunteer, how you can step up. We've got doulas here today that you should speak with if you haven't. I loved hearing that our nurses were acknowledged. So where are all the nurses? Can you just raise your hands? Dorothy, that includes you. A lot of us have spent our lives in different areas, but one of the things you heard today was about health equity. Health equity truly is something, when we all focused on the Affordable Care Act and Obamacare a number of years ago, we were proud to make that initiative. Quite honestly, that initiative was about money. And the money was to come and to here. And it is now time for the city of Chicago, for our state of Illinois, to apply and look at programs like we have today to expand them throughout and grow these programs so we don't have to report to you statistics about poverty and about people having unfair health care because of where they live and what their zip code is. And that's got to change. And we will do what we can at Marillac St. Vincent to help. And we want to thank all of you for your effort because being here today is supporting that change. So thank you all. All right. I guess last but not least, it's time to announce our raffle winner. And we're going to actually finish a little bit early, which is great. Let's make sure I did it right. I have to double check. Did I say it right? Aaron? Oh, okay, Mr. Doubleday. Aaron Doubleday, Miss Doubleday, come up. You've won. Come on up. I'm not even sure what you've won. Oh, of course, perfect. You won wine, so come on up and collect your wine. I don't know if you want to donate it back to all of us, but we'll be happy to meet you in the corner. Thank you once again to everyone here to support what we're doing at Marillac St. Vincent. Thank you for your continued support. Thank you to the Daughters of Charity who started this and got us moving in the right direction. And we're thrilled you're all here. We're going to end early, so meeting adjourned. Thank you all, and we'll see you next time. Bye.